It is so important to keep you safe and well. Here at Living Well, Danielle and I take your health and COVID safety very seriously. With opening our borders here in South Australia, we strive to keep your COVID risks to the absolute minimum that we can. To keep your risks to the minimum, we have set up 2 separate waiting areas, one on the inside and one outside. Not waiting in the allocated area may increase the likelihood of catching or transmitting COVID, which no one wants. To minimize this exposure, patients now present to the door at the back of the NAB building. There's only one door and you can follow the arrows. Where you sit will depend on your vaccination status, as in your COVID vaccination. If you've had your vaccinations and you are up to date, this means that you've either had 2 primary vaccinations, or if you are immunocompromised, as in you've been on a medication that suppresses your immune cells, you've got a certain cancer that does, or a chemo that does, then you'll have required 3. Has it been over 2 weeks since you finished your primary set of COVID vaccines, and has it been less than 6 months ago that you completed it? If so, your vaccination status is up to date and come on into the clinic. You can let Danielle know that you're here and update any of your contact details or Medicare card number, and you can have a seat in the waiting room. If there's already someone in the waiting room, please sit in the outdoor waiting area. When they go into my consultation room, you're certainly welcome to come back indoors and sit in the waiting room there. If you've not had your 2nd or 3rd primary COVID vaccine, or it's been less than 2 weeks since that last one, or it's been over 6 months since your last and you're due for your next booster, please present to the screen door and just let Danielle know by calling out to Danielle and saying hi that you're here. Danielle, come on out into the outdoor waiting area and confirm your details and ask a few COVID questions. And when I'm ready, I will come out and call you into my consultation room. Following your consultation, you'll return to the outdoor waiting room again, where Danielle will bring the Tyro gadget for payment and can arrange your next appointment. This flow of people is designed to keep you and your health as safe as possible. We are not isolating you, we are protecting you. Remember to maintain 1.5 meters social distancing with all others, including Danielle and other patients and myself. I will maintain 1.5 meters, of course, unless I have to examine you. In keeping with minimizing the number of contacts involved in your consultation, only one person, as in the person who has the appointment, may come into the building and into the consultation room. Should the person that has the consultation be a child, less than 18 years of age, then their parent may accompany them. If someone doesn't have the physical capacity to move on their own in the building without more assistance than I can provide, then a support person can accompany them. And should a person have a mental incapacity for whatever reason that requires another person to be there to support them so that what needs to be attended to during the consult is, then they can accompany them as well. And they will be asked the same COVID questions and assigned appropriately to the appropriate waiting room based on their vaccination status, and we will document their presence. If we don't follow the waiting room guidelines and allocations for this, it could mean that should someone become COVID positive, you may have to isolate or isolate longer. Some people may think this is inconvenient, but we feel that getting COVID or having to isolate or isolate longer is even far more inconvenient. Some people may even think, is this COVID dance, this cha-cha-cha that we do of 1.5 meters, does it really make a difference? Here at Living Well, we've gone to a lot of effort and research to provide the best care and wouldn't be doing it if it didn't make a significant difference to your health. So yes, without a doubt, social distancing makes a difference. If you want to be in the consult with your loved one, then we can do something like video consult for you. So the patient's in with me and we can set up a video link or FaceTime or GP consults or Wellio, or we can get you on the speakerphone so you're there in presence, maybe not in person. I also want to take this opportunity to remind you to wear your mask and to wear it properly at all times. Make sure it fits and sits easily on your face and does not require adjustment. Do not take your face mask off to get your phone working or do anything else that way. And that includes being outside. Thank you. Now you're ready for your next consult and minimizing your COVID risks. Keep well and stay safe.